in their town.
You know, one other area, Roger, that we should talk about is that this expands the law about dispensaries. There's a lot of talk about dispensaries, but the other expansion of a law is in the number of conditions. Under the law as of 1999 and 2002, there really were a very narrow number of conditions that people could use medical marijuana to treat. This law actually expands it to several additional conditions, as well as different diseases that have symptoms that will be benefited by the use of medical marijuana. And I know we got some medical people here tonight that might be able to at least address kind of the additional number of conditions this is going to apply to.
Sure. Dr. Wojtowicz, you've been prescribing for some years now under this law. How does the new law change your ability to prescribe, and how do we know that people aren't coming in trying to abuse your good nature by convincing you to prescribe when they really don't need it from a medical perspective? Has that been your history or your experience or not?
I don't think many people have come in to try to abuse the system. I think the expansion of the indications are pretty thoughtful and they're wise. Well, they include hepatitis C, some applications for Alzheimer's treatment, and there's one for Crohn's disease as well. And those are reasonable expansions, you know, of the law. In my practice for the last 10 years, I've been sensitive to the issue that people sometimes don't have optimal treatment, or they've expended all the alternatives that are out there, or they have too many side effects from medicine. We've heard some comments about that already today. And from a compassionate point of view is why I've entertained using it with patients. I do a full assessment. We look at medical records. Some of them are my own patients, and some are people who come from elsewhere who need a consultation. I expect to have an ongoing relationship with these patients and see them, you know, throughout the year on a couple of occasions. We can continue to monitor what's appropriate for their treatment. And most people seem to understand that very well. Most people will come back and are willing to work with someone who's willing to work with them.
You know, some of the problems Walter was talking about in California, I think we avoid some of those, don't we, in Maine? You have a fairly narrow list of conditions for which you are entitled to prescribe as compared with any medical condition that seems to warrant it?
I think that's what's prudent about the Maine law, is that it is kind of specific and narrow in focus. And so it's easy to sort of contain the use of medical marijuana based on those indications. And therefore, I think there's a less opportunity for abuse. I've not seen that much abuse in my experience in the last 10 years.
One other question, if I could. How do you answer those critics who say that marijuana, you know, it's going to get abused and it really is a gateway drug to other harder drug use, and we're just going to help facilitate that through expanding the legal use of marijuana in Maine?
Well, that's always an interesting debate. I think there's literature on both sides of that debate, whether it's a gateway drug or not. I think it's sort of our important choices to sort of consider how to implement something that's helpful for people and take into account all the possible ramifications of that. I don't think that patients that have been coming to me are necessarily going down a path of addiction. I think most of them have been very prudent in their use. They use minimal amounts. I think the public is very, you know, wary about it and scared because drug abuse is a big public issue. But I don't think it's a poor example for even youth or other people in the state of Maine. It's just a prudent application of how you can use marijuana. There's many drugs, even alcohol, which can be used socially and appropriately, and then they can be abused as well. And we can learn from all these experiences.
I'm going to come back in a minute. The new dispensary law is not without its critics. We've got a couple of them here tonight. We're going to hear from them right after this break.
Your home is your largest investment. Who will you trust to keep you safe and warm this winter? Dirigo Stoves. With many years of experience installing and servicing heating appliances, they are Central Maine's alternative heating experts. Everyone is concerned about the cost of energy. Dirigo Stoves will evaluate your needs and even come to your home to ensure that you are making the right choice of a heating appliance for a proper installation. Imagine the peace of mind that comes with knowing that the stove you purchased is safe and efficient. You can rely on Dirigo Stoves for wood and pellet burning appliances that will keep you warm and save you money. The price you see listed on pellet stoves in the showroom includes the hearth and direct vent kit, everything that you need, no surprises. Plus, many of their appliances qualify for a 30% tax credit. Dirigo Stoves has plenty of wood pellets on hand, and they're selling them at competitive prices. Dirigo Stoves, Central Maine's alternative energy heating center, 11 Chaplin Street in Waterville, 872-5760. Or visit them at dirigostoves.com.
And welcome back. Maine's new medical marijuana dispensary law. We've heard from a number of people talking about how it's going to work. I'm now going to talk with a couple of people who don't really like the idea. First of all, Dr. Mark Publica is an addiction specialist, a doctor at Mercy Hospital in Portland. And I know, Doctor, you've got some real concerns about this dispensary law, right?
Right.
What are those?
Well, first, a little historical context. 15 years ago, the medical community and probably every major medical organization provided total support for an expansion of opioids for non-malignant pain. There was a great deal of promotion. There was a general consensus this was a good idea. Now we're sitting here in a state that has one of the top rates of opiate addiction in the nation. I have no qualms about saying that cannabis has a clear role in the management of some conditions, but the way the law is drafted, it exposes vulnerable populations that should not be exposed. There is broad consensus in the research community that cannabis use in children and adolescents is harmful. And rates of major psychiatric illness, including schizophrenia, are significantly raised with use in the teenage years. In addition, we know that children with ADHD who smoke cannabis have a significantly greater lifetime risk of developing addiction. There is no comment in this law about pregnancy, but I think that they're, again, looking for the protection of children. We also have to look at the protection of pregnant women and fetuses.
So your point is there's nothing in this law which prohibits a doctor from prescribing medical marijuana for a 10-year-old or a 12-year-old?
Yes, exactly. So the law actually sets no lower age limit and specifically states that. The other concern that I have is an impairment issue. The language is very, very unclear. At one point, the language talks about not driving a car, operating a boat, or flying an airplane under the influence. Now, under the influence is an interesting concept. It's undefined. In the current consent form, it actually stipulates that patient has been advised not to drive a car. I have an additional concern. There's no comment on whether or not physicians, other medical personnel are covered, because the law prohibits discrimination by licensing boards for medical marijuana users. If I was undergoing neurosurgery, I wouldn't want to have my neurosurgeon be a medical marijuana user, having used prior to surgery. So I think that there are some areas that the legislation needs to be tightened.
Thank you. And we're going to talk with another critic now, Don Kristen, and we're going to ask Representative Haskell to respond in terms of what the committee is doing. Don, you're the longtime leader of Maine Vocals. You are an outspoken advocate for the legalization of marijuana across the board. You are an advocate for its medical use as well, but you're very much opposed to this dispensary law. Why is that, Don?
Well, it's being put into a place now that is going to be heavily regulated. Excuse me, it's being put in front of the DHS to perform the dispensary duties and regulation rules, what have you, for the medical law. And that's a direct conflict of interest with the DHS involved with this. They take people's kids away for using marijuana at this present time. They have a drug program that tells people that marijuana is bad all the way around. And you know, it hasn't worked for the last 10 years. The legislature's failed to do anything with the law. But people have been able to use it sparsely, but people have been able to use it. And we're just now getting to the point where we can figure out how to get around and utilize the law. And we've come up with paperwork for doctors to use for therapy forms, and people that are patients to give to caregivers should they need a caregiver. And that's pretty much what a dispensary is, a caregiver. I am also a caregiver. I'm a medical marijuana patient. I have doctor's approval. And we want to see a law that will work for the people and the patients of the state of Maine, not be put with people who could care less about this law, have done nothing on it for 10 years. We want it to be kept with the people.